Okay, I became a vascular surgeon through a slightly convoluted route via anaesthetics. So I started my anaesthetics training and was really enjoying it. It's a great specialty, but I think I'd always wanted to be a surgeon, and that was just confirmed when I did my anaesthetics training, really. I was watching the operation and realised I wanted to be on the other side of the table. So completed core training. I started like a ST3 Latin anaesthetics whilst applying for core surgical training. I'd absolutely loved vascular, kind of themed anaesthetics as well. I'd worked at the Western in Glasgow where they had a good vascular unit there. So I applied for the vascular themed core surgical job in Edinburgh and got that, and yeah, just continued to pursue it. Got the ST3 vascular job in Scotland, and that's how I got to where I am today. Outside of work, I like to run a lot and go up the mountains and find sunsets in beautiful places. And I guess just what everybody else likes to do, hang out with my friends and eat good food and drink good wine. My favourite operation very much depends on what day it is, I suppose. So if you're having a quiet day, something like a fistula would be lovely, just sit down. Such beautiful surgery, nice dissection. If I'm feeling a bit more active and adventurous, then maybe something intra-abdominal, so an aorta, or if you just want to kind of refine your basic skills, something like common femoral endarterectomy is really nice, or something very elegant like a carotid on a different day. So I don't think I really have a favourite operation. It all depends on how you're feeling that day. So at the moment I'm on research, so I've come out of programme and my average work week is very much dictated to by where the deadlines are and what I'm doing, I suppose. But during clinical time we'd have a couple of days of clinic, a couple of days of theatre, lots of paperwork time as well. You've got to do that like every other specialty. So a bit of a mix really. Again, it depends what's going on in the week, I suppose, what operations are available and who's available, and yeah, it's very variable. So I've only just started, I'm 2 weeks in. It's very different. It's the first time in 10 years that I've not been doctoring, as it were. So it's a big shift in pace of life and focus of life. But it's also a really great opportunity to get a bit of your life back, get a bit of control over your own time again, and do something completely different. I think coming off the training treadmill, as it were, for a while can be really refreshing, and it gives you a chance to explore new skills and read about things that you wouldn't otherwise read about, and understand a whole different side of surgery as well. So yeah, we'll see how it goes, but so far I'm enjoying it. The most rewarding aspects, I suppose it's what a lot of people say about surgery in general, and vascular surgery in particular, is like how quickly you'll get your results. So if somebody's got an ischemic leg and then you go into a bypass, for example, their leg should pink up. Or if they're very septic from their diabetic foot and you take the foot away, then they will get better over the coming days, and hopefully, obviously. And so I suppose it's the quick nature of the results. I think one of the biggest challenges for me is realising that you can't change the world. So a lot of people will come in who are still smoking, or who are still injecting drugs, or who don't necessarily want to change their lifestyle and do their exercise programme, and that can be quite frustrating, especially when you spend a long time doing a nice operation. But equally, I think you just accept people for who they are and appreciate that you're helping them, you're helping them, and that's rewarding enough. So yeah. Organisation. So I think, again, with most medical specialties and almost any surgical specialty, you just have to be organised. So if you want to have a work-life balance, you need to take charge of your life and make sure it happens, essentially. By planning and keeping non-medics in your life, I think helps as well, to give you a bit of perspective and to get you into the bigger world outside of just surgery and just medicine. My advice to any aspiring surgeon would be to keep your portfolio ticking over from the start, so that you're not trying to cram for interviews and things like that, and to do the things that you enjoy, and that'll keep you on the right track in terms of which specialty, and also play the long game. It's your life ahead of you, so make sure that you are getting a good work-life balance but enjoying everything as you go.